Thanks Senator Stargell and Representative Hawkins for being here. We're pleased to announce that starting today at 12:30, we'll be offering monoclonal antibodies treatment free of charge right here at Lakes Church. It'll be open 7 days a week from 9 a.m. to 5 p.m. and we'll be able to treat more than 300 patients each and every day. The treatment of monoclonal antibodies using the Regeneron is designed for people that are at risk of hospitalization due to COVID-19. It's for people who are either COVID positive or who are high risk and have been exposed to somebody who is COVID positive. This has been available now since the end of 2020. It's been given the same emergency use authorization that the three vaccines have had, and has been used by our health systems in most parts of the state pretty consistently. However, it's something that a lot of people didn't know about, and so we've really helped raise the visibility of it. It's also something that prior to us setting up these sites, you would needed to go to a physician and actually get a doctor's prescription to be able to get it. So you have hospital systems that have infusion centers, physician refers you, go, no problem. What we've done here is had the Surgeon General issue a standing order, which makes it easy for people to be able to come in without having to necessarily see a doctor beforehand. And this is treatment that's available for people regardless of vaccination status. Obviously, if you're vaccinated, the chance of you getting seriously ill is less than somebody who is not vaccinated, all things being equal. However, people are testing positive who are vaccinated. It's not rare, it's happening. And then obviously, we know that a number of people that have been admitted to hospitals in the last month have not been vaccinated. And so this is once you're infected or once you have an exposure, this is early treatment that has been proven to reduce the risk of hospitalization by 70%. And that's true in clinical trials. It's also been true in the real world data when it's been used. The Regeneron is what's being used here at these the clinics that the state is setting up. And part of the reason that we're doing that, one, it's free. The federal government bought out the entire stock of Regeneron last year once this was approved. And so the state draws down these treatments, patients come in, and patients are not charged for the Regeneron. I think it's just important to stress that because you'll have people putting out misinformation saying, oh, this is thousands of dollars. And look, I don't know what the federal government paid for it, but they paid for it, it's done. And so a Floridian that comes in is not going to be charged that, and it's just important. We don't want that to dissuade anybody from doing it. So drawing it down, Regeneron is the one monoclonal that has been shown to be effective against the Delta variant. You had the Eli Lilly also came out around the same time as Regeneron. The data isn't as good with respect to Delta, so most hospital systems and physicians are opting for the Regeneron. Regeneron has also been approved for application not just through an IV, but also subcutaneously. And so when you're hooked up to an IV, it's basically you got to be on the IV for about an hour. That's what most of the health systems are doing because that had been how it was initially approved for. It's since been added where you can do the subcutaneous. So that will involve people can come in, you get 2 shots in the belly, a shot in each arm, and then you're done. So that does not take an hour, and it allows these sites to be able to process more people if the demand is high. And then finally, I had mentioned the Regeneron is the only monoclonal that's approved for use for prophylaxis. And so you can imagine like a nursing home, if there's a positive test somewhere, you can go in and provide this to nursing home residents who may have been exposed. And again, most of these nursing home residents, of course, are vaccinated. They were the first ones we went into to be able to help them, but you still have people who are testing positive. We, you look at the data in Florida, and I think pretty much every health system would say the patients that have been admitted for COVID treatment have been overwhelmingly unvaccinated. So there has been protection for particularly our elderly who were vaccinated. They're less likely to be hospitalized than they were prior to that. But it's also true that we spoke with pretty much every system we've spoken to, at least 90% of the patients that are admitted for COVID did not receive an early monoclonal antibody treatment. And so it's certainly my belief, based on the data, that had a lot of those patients gotten this, many of them would not have been admitted in the first place. And so we're trying to provide one way, if you are infected, to be able to get really the one proven treatment so far in terms of FDA emergency use that can help drive down hospital admissions. And at the end of the day, you get infected, you know, you're in bed for a couple days with a flu-like symptom and you recover. You know, that's much better than ending up getting admitted to a hospital and letting this progress. So the key here, though, is early treatment. If you wait until you're really, really sick and need hospitalization or intensive care, by that point, these antibodies have probably missed their opportunity to do what they need to do. If you get it early, you put the antibodies in, and they really can go to work fighting off the virus. And we've already had, just with our sites that we've opened recently, had some amazing testimonials of people who got hit, got infected, started to get massive fever, started to go in and get this, and then within 24 or 48 hours, they've had symptoms resolved, which is pretty incredible. So, but you got to do it early, and so this is something that you don't want to wait on, particularly if you're in some of the higher risk groups. And again, the EUA specifically focuses on folks who are at high risk for hospitalization. So those would be elderly, people that have heart or lung conditions, people that are overweight, people that have diabetes, kidney problems, compromised immunity. I will say, if you look at the people that are most likely to be hospitalized, would be people that are 50 and above. And I would say the vast majority of Floridians who are 50 and above would likely qualify for this treatment one way or another. And so take advantage of that. And we do think it will end up really helping you out a lot. So we now have, throughout the state of Florida, of course, here in Polk County, we also have Jacksonville, Orlando, Merritt Island, Pembroke Pines, West Palm Beach, Ormond Beach, Hudson, Bonita Springs, Miami, Panama City, and Fort Walton Beach. We will be adding shortly a handful of others throughout the state. And so by the beginning, early this week, you will likely have one of these sites within a relative distance of the vast majority of our population, which is a really good thing. And again, there's a standing order. So if you're somebody who is in particularly in a high-risk group, you get infected, you can come and make an appointment without having to go to your doctor. We're not saying don't consult with your doctor. It's always good to ask whether this is right. We certainly want you to do your due diligence, but a prescription's not required. So you can go to patientportalfl.com to find locations and to make appointments, similar to how we would book people for vaccines. This is the same type of deal. You can go on and book. You can also visit floridahealthcovid19.gov for more information on sites near you. These are not, the state sites are not the only way to get this, and so many physicians offer it, many hospitals offer it. Now, some hospitals would only do it maybe once a week, and so clearly this is helping to fill a void. Others do it every day, but maybe are limited to how many patients they can see. So we're trying to supplement what had been going on already. I think obviously we've raised the awareness of this, which is something that's really important, so that people know that this is something that they have an opportunity to do. We've already done thousands of treatments at our various sites, and we think at the pace we're going, we're going to do a lot in the coming weeks. And again, keeping people out of hospitals, reducing admissions to hospitals, that really is, I think, the key. Of course, saving lives as well, because if you don't get admitted to the hospital, then you're going to recover. So that's the name of the game here, and we've already seen some success with it, and I think we're going to see a lot more. So, Senator, did you want to say anything?
I mostly just thank you guys for being here, and thank you, Governor, for doing this. I know early in the week we got a call from Lakeland Regional, our local hospital, saying that they were very stressed, and I know Representative Burton and I got on the phone looking for something just like this. So thank you for having a multifaceted approach to how we address this. It takes it all. If you can get the vaccine, if you feel comfortable with the vaccine, get vaccinated. It may keep you from getting sick. It may keep you from getting the virus at all. But as you said, people with the vaccination are still getting sick. So if you get sick, come get the antibodies, come get the treatment. If you do that, you get the treatment, then you may not go to the hospital. If we all do our part and try to be compassionate and consider to those around us, wear a mask if you've been someplace or you are someplace where you may get others sick. It takes all of it. And so, Governor, I thank you so much for thinking out of the box, for really coming forward to this treatment, for promoting it. We in the Senate, when people got sick, we're doing the Eli Lilly monoclonal. I can tell you, multiple people, we were able to continue business because we had treatment and because people were better. This will do this for everybody. So these facilities across the state, the ease of which you can come and get the treatment without having to go through the doctor in the process, I guarantee you it's going to take the stress off of our healthcare systems. We're going to be able to get back to business. We're going to be able to then have the antibodies be healthy and continue to operate across the street. So I cannot thank you enough for my community and for what you're doing across the state to make sure that our citizens are healthy and can battle this virus effectively. Thank you.
And again, this is just one tool in the toolbox. This is not saying this is the only thing that you need to be doing. I mean, of course, you know, a vaccine is designed to prevent, I mean, ideally prevent infection. I think that that's probably not happened to the extent we had hoped, but also protect against severe illness. Millions of Floridians, particularly our elderly, you know, have gotten good protection of that, and obviously we're happy with that. This is, okay, once you're past prevention, if you are infected, and again, regardless of vaccination status, because we are seeing people get infected who are both vaccinated and unvaccinated, what do you then do? This is an early treatment option to be able to go in and do that. So it's not the only tool, but it is one tool, and it was clearly a tool that was being underutilized because many people just did not know that this was something that was available, and that became apparent to us as we started to see hospital admissions increase this summer. We were talking to some of the hospital CEOs and talking about the different kind of the patient mix, and they said, look, when the patients, if they come into the ED and they're early enough and we can get them on a monoclonal, we usually don't see them again. And so they advocated that, and I've been advocating it too, but people then started saying, well, what is this? I've never heard of it. So we started talking more about it, and then we said, you know what, let's get this in the communities more so that we can hopefully relieve some burdens on these hospital admissions. And so now I think more and more people understand it. It is not something that is really new in terms of using monoclonal antibodies to treat different things. Obviously, this is geared towards COVID, but it isn't like this is some type of new technology necessarily. They've been using monoclonals for decades. It's also something that is widely accepted as being effective. I mean, for example, obviously we here in Florida are pushing to provide access to this, raise visibility, but you have the Biden administration's U.S. Department of Health and Human Services. They're advocating for it. They're letting people know that this is something that is important. Obviously, the Trump administration bought the Regeneron in the first place, so they were also supportive of it. And I think that I haven't seen very many physicians that have had any negative feedback about this therapy. So we think it's something that is important, underutilized, now more knowledge about it and more access to it, which is great. So we do think that if folks come early and do this, we absolutely think that there will be people who otherwise would have been hospitalized who we will be able to save from having to go into the hospital, which is really the name of the game. Okay, I can take a couple questions.
Governor, some of these healthcare industries are stressed, like you mentioned. In the cities that you have these centers, are you seeing that be alleviated? Are you seeing that data?
So the first area we did was the area that had been the hardest hit was the Northeast Florida. So we've put it in, and I think their hospital, at least in their bigger systems, you know, they've definitely seen a decline in patients, which is good. Their census is down. We think that trend will continue. We also had great reports out of Jacksonville where people who were really ill going in there And there was even testimonial saying, hey, if I had not done this, I definitely would have ended up in the hospital. I could have even died. So we think as the numbers increase in terms of the treatments, I think we'll be able to see it a little bit more, even clearer in terms of the hospital admissions. But yeah, we think it has had an effect. And then I think as more and more of this happens, we think it'll be reduced even more.
Governor, on a little bit of a different shift, Sarasota just passed this mask mandate yesterday. Do you anticipate more school districts doing this, and what's your reaction to this?
So my view is parents are in the better position to make the decision about whether their kids should be wearing the mask in school, particularly young kids, better than the government is. And I think you have politicians who are doing this. Obviously, they're aligned with certain political interests. They're violating state law. The state of Florida, the legislature passed a Parents' Bill of Rights last session. I signed it. This is the implementation of that. And understand, they are absolutely thumbing their nose at what the law of the state of Florida is. And I think when you look at kids who are 5 and 6 years old, to force them to wear masks all day, there's a lot of parents that don't think that's the right decision. And mind you, we're now in a situation where these vaccines have been readily available for all adults. I mean, any staff member has had access to this for months and months and months. And then last year, obviously, that was not available yet. But even last year, we had a number of our school districts that did not impose this requirement. The results were there was no discernible difference across districts based on this policy. And I just worry about particularly these young kids having to do this. And the question is when does it end? They'll tell you, oh, we're going to do it for 2 weeks or 3 weeks. But remember, they said 15 days to slow the spread. Remember that? 15 days? Then it became, well, no, we don't have vaccines, so you got to mask and lock down until vaccines. Now, in Florida, we obviously didn't believe that was the right thing. We believe we had to empower people, lift them up, not lock them down, and get them to work, get them in school. Nevertheless, vaccines come out readily available now, and you have people saying, well, even though you have anyone who wants a vaccine, adult, just go to CVS, go to Walgreens, you get it free, no problem. Even though you have that, now you have people saying, well, we still may need to do X, Y, and Z. So the question is when would that stop, particularly given that COVID is effectively going to become an endemic respiratory virus like the other 4 coronaviruses. And so I also worry about, okay, what does this mean for parents' rights going forward? COVID, if you look at the hospitalizations, if you look at the mortality, is lower for pediatrics than most influenza seasons, and certainly compared to like an H1N1, which was, Biden was vice president, they weren't forcing the kindergartners to wear masks for H1N1. That was much, much more lethal for young kids. So the question is, if you're forcing this now, if you're taking away parents' rights now, what's going to happen in future respiratory seasons if we have flu, other things start to do. So I just think that the parent really needs to be the one that is making the decision, and I think that's the better way to do it. Fortunately, most places in Florida, of course, following the law. Others aren't, but some people have their different things. I mean, look, there's no doubt about it. You follow the law in Florida as a school board, you aren't getting invited on CNN. We know that, okay? If you break the law, you're going to get on CNN. You're going to be able to get some fanfare from certain quarters. So we understand that. But the question is that the right decision for parents to take away their agency over this, or are we better off just making it for parents? And notice, no one's saying that parents who want the kids should be banned. You can make that decision for yourself. And I think that's the better way to do it. And when you start forcing, though, and you're not following the law, that's where we end up having, I think, a lot of the division and stuff. So I would just say trust the parents, let them make the decision, and I think ultimately that will be the right thing going forward. Okay, we got another one I got to open, so we will see you guys next time we're in town. Okay.